Hi again and welcome back. It's Dr. Keneth Hall from upstate New York at Rome Memorial Hospital. There's been a lot of talk in the media recently about this medication called ranitidine, otherwise known as Zantac. This medication has been around for many years and it's been effective in the treatment of heartburn, otherwise known as GERD. In September 2019, there was a statement by the FDA which basically said that they did find certain levels of NDMA, which is a carcinogen, in this medication, which is higher than acceptable levels. Over the past several weeks, we have heard from the manufacturers of this medication that they have voluntarily recalled the medication. Now, there are other medications in this class which can be used to substitute the treatment of heartburn in these patients who have been on this medication. Now, as a patient who have utilized these medications for your symptoms, you may be wondering, what are my chances of developing cancer and what are the other alternatives to this medication? Now, it's uncertain as to the exact dose or the exact amount of this drug that is carcinogenic, but it's clearly shown in animals that this is a carcinogen. And for obvious reasons, these studies cannot be done in human beings. Now, most primary care physicians, gastroenterologists, and even surgeons are recommending that their patients either switch to a different medication or stop that medication completely for obvious reasons, because we're certainly unsure. In October of 2019, the FDA did make a second statement stating that these drugs in which the NDMA is above an acceptable level should be voluntarily recalled. So patients have been voluntarily changing their medications to different medications, such as cimetidine, which is in the same class. Now, this brings me to a very important question. What do you do if you have long-standing GERD or heartburn? Let's take it from the top. GERD is simply reflux of gastric contents into the esophagus in such a way that it does cause pain and discomfort. Approximately 60 million Americans walk around with this condition, whether they know it or not. For most people, medications such as cimetidine, ranitidine, which are called H2 blockers, may be the first-line therapy, while if those fail, a second-line therapy such as PPIs are often used. Often, many patients have different comorbidities such as morbid obesity. They may have an hiatal hernia, for example, and these patients sometimes may not be amenable to medical management alone. And as such, surgery may be an important tool to attaining good treatment and efficacy. I've often seen patients in the office who have been on multiple medications, including multiple PPIs, H2 blocker, and sometimes a second medication, and still continue to have symptoms. We have modern procedures including laparoscopic surgery, robotic surgery, and even open surgery for some of these conditions. We have found them to be significantly effective compared to medications alone. One procedure in which I have a special expertise is a diaphragmatic hernia repair for patients who have diaphragmatic hernia associated with GERD, as well as a procedure known as toupee fundoplication, which is a stomach wrap. Oftentimes, patients do very well, and in a very short period of time, they're able to come off their medications within weeks of surgery. Surgery is invaluable to the treatment of many of these patients and should be definitely considered for patients with refractory heartburn. I look forward to seeing patients in the office, and I'm available for consultation for any patients who think they may be a candidate. It's also important for us to educate our patients of the different options as it relates to how to manage this very dangerous disease. And lastly, I must say, in this country, the most common cause of esophageal cancer is heartburn. So it is an important issue that needs to be handled appropriately and urgently. Thank you very much.